As cliche as it sounds, I think good vision is worth protecting. Even when nothing feels wrong and you're not experiencing symptoms, it's still worth having that eye check just for your own peace of mind and making sure that everything actually is okay. A lot of eye conditions develop quietly, so people might go on for a long time before they realize anything actually has changed. And then to sort of go on from that point, I think early detection, it just gives us so many more treatment options. The outcomes are just so much better. So regular eye exams really is the way we identify these early changes and protect sight. So get your eyes tested.
Many people think that an eye test is simply checking whether you need stronger glasses, but modern optometry has become much broader than that. Today's eye examinations can help detect eye diseases before symptoms appear and even diagnose complex conditions affecting the surface and interior of the eye. Today, I'm joined by Jayden Simpson, new optometrist at Ezekiel Eyes in Perth. We'll be discussing children's eye health, specialty contact lenses, keratoconus, dry eye disease, and why regular eye examinations are important throughout life. For those who are new to this channel, my name is Paul Selloway from Optics Digital Marketing. We're an agency that helps eye care professionals connect with their communities through educational conversations like this one. So, Jayden, nice to meet you.
Nice to be here, Paul. How are you?
Very well, thanks. Very well. So listen, let's begin at the beginning, as they say. So maybe because this is going to be the first in what I think will be a series of videos, perhaps you could tell us what is Ezekiel Eyes and what is the Jayden Simpson backstory. So how did you wind up finding yourself at Ezekiel Eyes?
Sure. So I'd love to go into that. So Ezekiel Eyes, it's an independent optometry practice in Nedlands, in Perth, Western Australia. It's got a really, really rich history there. So I believe the practice was founded in 1916, and it's actually a third generation family practice. So it's currently being run by Damon Ezekiel, who's a guru in all contact lenses. So I
Yes.
feel very, very lucky to be at the practice. And as far as what we do at Ezekiel Eyes, it's a little bit different. So we see a lot of really, really interesting cases every single day. We do a lot of the specialty contact lens side of things as well. But beyond the contact lenses, we also see a lot of children. So we do a lot of pediatric eye exams. And we also do a lot of dry eye. And as a practice, we're very, very lucky in that we're able to spend a little bit more time with our patients, and we have really, really good technology there as well. So that's the practice. As far as how I wound up there, I was obviously studying optometry at optometry school, which happens to be just up the road from the practice. And I remember contact lenses were introduced to us in my second year. And I sort of sat there and I watched the practitioner deliver these contact lenses to this patient that had quite irregular surfaces to the front of their eye. And they'd pretty much been going their whole life without being able to see clearly. And I just remember really, really clearly that when the optometrist at the time put those lenses on the patient's eye, they could really just see for the first time, and they were very, very overwhelmed. They were crying, happy tears. And it was just amazing, I think, to see the difference that these small pieces of almost plastic, if you will, can make in these patients' lives. It stuck with me, and I sort of decided at that point that I wanted to go into a contact lens practice. So I wasted no time. I reached out to Damon and I asked him if I could shadow him. And then he's more than willing. So he's very good with students. So I sat in with him. And then he said, look, if you want to come back, you can. So I followed him up on that offer. I came back. I ended up being in the practice 10, 15 times. And then I popped the question to him at the very end and asked if he might have a position coming up. And he said he did. And then it's all went on from there. So really, really happy. Couldn't be happier. That's how I ended up here.
Great story. Yeah. So it's so contact lenses really can be quite a life-changing thing for a lot of people, and it sounds like that had a kind of an emotional impact with you.
Yeah, it's amazing. I
Mm.
sort of dream job.
Mm.
I pinch myself every day, which is good.
All right, Jayden. Well, many parents only organise eye examinations after their child starts struggling to see the board at school. Why should children have regular eye tests even if they don't seem to have any vision problems?
Yeah, so it's a really good question. It's something I'm quite passionate about. So we see a lot of pediatrics, like I was saying, at Ezekiel Eyes. I think the big reason to bring kids in, even if they're not complaining to you, is because a lot of the time what I find in practice is children might have these vision problems or these vision issues, but they might not actually recognize that they have them. They might assume the way that they see is normal, even if when we put them on the chart, it's not so normal. The other thing that I find is a lot of the time kids don't really have the vocabulary or the words to explain the issues that they actually might be experiencing. So concepts such as blur or concepts such as eye strain or double vision, it's really, really difficult for a child to actually explain that to a parent. So I think the big thing is just because they're not complaining, I wouldn't assume that nothing's wrong. I think it's better to get it checked out even if they aren't complaining. The other reason I would say, and what happens a lot in clinic and I see a lot, is what tends to happen is if one eye has poor vision or one eye is having issues, the brain's quite amazing at compensating for this with the good eye. So a lot of the time, it's not until the child sits in the test chair and we test each of the eyes individually that a problem's actually revealed, just because the good eye's been compensating the whole time. The other reason I would say is an eye exam these days, it's a lot more than testing vision. So a lot of parents think that just because their child can see the board or they can see signs okay, that there's no issues. But modern eye exams these days test a lot more than clarity. So when kids come into our chair at Ezekiel Eyes, of course we test the clarity, but we also test how the eyes work in isolation. We test how the eyes are coordinating together. We test how the eyes are focusing. We test whether the eyes are aligned or not. So there's a lot more that goes into an eye exam these days than just checking for clarity. The other thing, and I really could go on all day about this, Paul, but I'll keep it as short as I can, is it just gives us a good baseline. So the first time we see a child, we can take the measurements that we need. We can take objective measurements. We then have a baseline that we can compare over time. So we basically have data that we can use to compare how the child's eyes or vision are changing, and we can compare to themselves, which is helpful. So there's so many reasons. It's very important.
Well, short-sightedness or myopia is something that, we hear more and more about these days, and, maybe changing lifestyles is part of that. So what is myopia management, and what does it involve for patients when they come into your clinic there at Ezekiel Eyes?
Yes, it's a great question. I think before I go into it, I'll just explain what myopia means. So I would imagine a lot of the audience has probably heard it described as short-sightedness, which is the term that most parents will be more familiar with. And basically, what short-sightedness is generally you can see up close, okay, but things in the distance tend to be quite blurry. So the most common complaint will be the board at school looks blurry. The reason for this is because the eye is slightly longer than what it should be. So you have a longer eye, basically it affects the way that the light focuses and it causes blur. Now, myopia management, basically the overall goal of myopia management is to stop this eye getting longer and to stop the number or the prescription going up. Now, traditionally, the way we managed myopia was we just gave the child or the adult glasses. And the glasses provided them amazing vision, but it did absolutely nothing to slow down this eyeball growth. It's a little bit different now in that the approach we take is we still have all these options that correct vision and sort of get rid of this blur, but it also slows down the stimulus that's making the eye want to grow longer. So we're treating it whilst giving good vision. The way we do this, again, this could be a conversation I could go in all day about, but there's so many different myopia control strategies. Just to go into them very briefly, the first one we typically go with is the spectacle lenses. So basically, they're specially designed lenses. You wear them like any other glasses, you get great clear vision, but they have a special technology in the side that acts as a signal to slow down the eyeball growth. Can put the exact same thing as a contact lens, and then the kids wear these. It's a daily disposable. They wear them, toss them at the end of the day. The other thing, there's another special type of contact lens, which we fit a lot of in practice called Ortho K. Some parents might have heard it be referred to as night lenses. Basically, you sleep in the lenses, they reshape the front of your eye, you wake up with nice, clear vision, and it will also slow down the growth of the eyeball. The other thing is there's also eye drops. So a lot of the time, parents can also use eye drops, and basically you put the eye drops into the eye before the child goes to bed, and then they also slow down the growth of the eye. So as far as what myopia management involves, it starts as a conversation to find out about a child. What are their needs? What's their prescription looking like? How are things changing? What are their risk factors? And then we tailor the solution to find the closest thing and the most appropriate option for the child. But the big thing now is we're actually doing things to slow down the growth, which will reduce the chance of having any issues into the future. The big thing I would say is a lot of these control strategies, because the child's still growing, everything in their body's growing, we can't stop the eyeball from getting longer. But a lot of these will be very, very effective at slowing the eyeball growth down. And they're very, very effective strategies. The outcomes we get in clinic are amazing. So it's a lot more involved these days. And technology is constantly evolving. It's a really exciting space to be in, actually.
Well, myopia is a very broad topic, and like you said, we could probably do a whole 30-minute video about this, but we're not, at least not today.
Of course,
But
of course.
but you said you mentioned about contact lenses. You mentioned a couple of types of contact lenses. There are soft contact lenses for myopia control, and also
Mm.
ortho K contact lenses. So more generally, when people think about contact lenses, I think many people think of just the soft disposable contacts because
Mm.
they're kind of the popular variety these days. Are patients surprised when they discover how many different contact lens options now exist?
Oh, patients are so surprised. It's one of my favorite things is because at Ezekiel Eyes, we fit a lot of the hard contact lenses. So
Mm.
like you're saying, traditionally when patients think of contact lenses, they think of those simple daily disposables. You wear them and you toss them. We fit those at Ezekiel Eyes, certainly, but we do a little bit more of the more complicated special contact lenses, which are harder and they actually form a smooth optical surface over the eye. Patients are always surprised when you show them. They haven't heard of them before or they haven't seen them before. But I think the main thing that surprises patients with contact lenses these days is just how many problems you can actually solve with them. So these days, the way we view contact lenses is it's not simply an alternative to glasses or it's something that fixes a prescription, but there's so many other uses, particularly in therapeutics. So you can use contact lenses to correct patients that have these really, really irregular eyes where glasses just don't work and they don't get good vision out of glasses. You can use them when the prescriptions are really, really high as well. When you put the prescription into spectacles and they cause this minification or magnification. So contact lenses are great for that. You can use them in patients that are getting a little bit older to give them not only clear distance vision, but you can actually give them near vision as well. So there's special multifocal contact lenses that you can use. You can use contact lenses to treat dry eye these days. So a lot of patients have dry eye symptoms and they have this discomfort on the front of their eye. And there's these special lenses called scleral lenses, which basically you fill them up with a fluid reservoir and they sit on the front surface of your eye and you have fluid sitting against your eye for the whole day. There's so many different contact lenses these days. There's so many different options. They can deal with so many different issues. They're amazing. I can't overstate the possibilities and the amount of research that's going into the market these days. It's constantly evolving. They can do a lot. They can do a lot.
So do you get patients who come in and say to you, look, Jayden, I tried contact lenses years ago and I couldn't wear them. They're not for me. Has the technology behind contact lenses really changed a lot in recent times? Does some of these people maybe not aware of how improved the latest options are?
Oh, absolutely. It's a pretty common consult that we'll do in clinic in that we'll have patients come in and they'll might have had a bad experience or it just didn't work and they'll drop out of contact lenses for whatever reason. As long as the patient's motivated, in most cases we can certainly find an option. The amount of research that's going on behind the scenes and the amount that these contact lens technologies are developing is crazy. The contact lenses that we're fitting today are nowhere near like the contact lenses we were fitting 10, even 5 years ago. They're so much more comfortable now. The amount of oxygen that you get to the eye is a lot better. The outcomes are just better as well. The optics in the lens tend to be better. Just because you've had an experience in the past, I think the key message would be doesn't mean that you're unsuitable today. I think in most cases, then not. We just have so many different options, so many different things that we can try. If one thing's not working, we can just pivot to another thing. Yeah, it's amazing how quickly things are changing in the space as well.
Today I was at the shop and I bought myself a couple of t-shirts and I was thinking, like, I know we're going to have this conversation today. I was thinking, why isn't buying contact lenses a bit like getting clothes off the rack? Why is contact lens why is getting fitted with contact lenses such a personalized thing, customized thing?
Yeah, it's a really good question. I like to remind myself when we have a patient in the chair that each person that's coming into your chair, not only are they a different person with different experiences, but they also have completely different needs. So I guess it's super important with these contact lenses, especially the more specialized fitting. You really can't take a cookie cutter approach because of how different anyone is. The first thing is anatomically, eyes vary significantly across people. So there'll be different shapes of the cornea, which is the front of your eye. There's different eye sizes. There's different eyelid anatomy. Some patients would have had previous surgeries. Some patients might have had previous injuries. That's just the difference in the eye alone, which you need to account for. Now, the next thing you need to account for is patients' everyday needs. We might have someone in the chair that wants to play golf and they need really, really good distance vision. We sometimes have surgeons come into our practice as well that are operating and they need really, really good up close vision. We might have people for everyday use that need good distance and close and intermediate. So there's so many different variables that need to be taken into account when someone sits in the chair that you really can't just give someone a contact lens and give the next person the same ones. It's such a individualized, personalized thing. And I think that's where my passion for it comes in is if you listen to the patient and you take the time and you're really aware of all the options that are available, then you can get an amazing outcome. It's an art. It really is. It really is.
It's an art and a science.
Yes, exactly.
Well, if you're watching this on YouTube and you're enjoying this conversation, then please do us a big favor and hit the like button and subscribe to the channel because it helps us out with the algorithm and increases the chances that other people are going to benefit from this information as well. So, Jayden, keratoconus, this is a condition that perhaps many people have never heard of. What exactly is it and why is early diagnosis so important?
Yeah, of course. It's a great question. And we see a lot of patients that have keratoconus at Ezekiel Eyes. We also diagnose a lot of patients with keratoconus for the first time. And when we have the conversation with these patients, a lot of the time what they say is they'd never heard of keratoconus before diagnosis. Now, as far as what keratoconus is, I think it's important to go into some of the anatomy behind it. So to put it simply, I'll keep it quite brief. Basically, the front of your eye, you have something called the cornea. And basically, the cornea almost acts like a smooth window that allows us to see clearly. Now, normally, this smooth window is nice and regularly shaped, and there's no bumps in it, there's no notches. It's a nice spherical shape all the way along. Now, what happens in keratoconus is this smooth window starts to become thinner over time. It starts to become a little bit weaker over time. And what happens with that thinning and weakening of the cornea is you get this small sort of protrusion or bulging. And this protrusion and bulging changes the shape of the front of the eye, which changes the way that light interacts with the front of the eye, and it can scatter light and cause things such as distorted vision or blurriness, or you might get halos at night. So, to put it simply, it's the thinning and bulging of the front surface of the eye, which causes an irregular surface. Now, as far as why early diagnosis is so important, is because sometimes this condition can progress over time. It's difficult to predict, truth be told, but the main thing why early diagnosis is important because firstly, we can establish baseline measurements. So basically, we get a good picture in time at this date of what the patient's cornea is looking like. We can then get the patient back at another point in time and we can compare those two consecutive measurements and we can see whether or not there's progression. Now, if there is progression, then there is treatment options available to slow down that progression. It's something called corneal collagen cross-linking. We can't determine basically if there is progression if we don't have a baseline measurement. So super, super important. The other thing that makes early diagnosis important is there's behavioral modifications, which we can go through with the patient to try and also stop the condition from getting worse. If you speak to anyone with keratoconus, the first thing they'll tell you is it's really, really important that they don't rub their eyes. So the earlier we pick it up, the earlier we can counsel the patient, the earlier we can get on control, under control allergies that might make them want to rub, and the better the outcomes are as well for those patients.
So the way it's been described to me is that if you think of the cornea as kind of like a soccer ball, which is
Mm.
topical now because the World Cup's on, but if you think of it as a soccer ball, patients with keratoconus, it's more like the pointy end of a rugby ball or an AFL ball. Is that right? Is that close?
Yeah, spot on.
Yeah.
Another really good analogy is if you have a worn tire and it has a weak spot in it, at
Right.
that weak spot, it will start to bulge. So
Mm,
basically, what's happening is at that area in the cornea, it's quite thin. So it's
mm.
bulging forward because it is structurally weaker than the rest of the cornea. But you're spot on there. That's a good analogy.
And so corneal cross-linking is something that an ophthalmic surgeon would do, and you would refer the patient in that case. Is that right?
Yes, exactly. So in order to see an ophthalmologist for corneal collagen cross-linking, in most cases, what they will want to see is that the patient has demonstrated progression. So
Mm,
again, that's why baseline is so important because the first thing we send through to the ophthalmologist when we refer them on is we send them their data. And the first thing they're going to look for in the data is that this keratoconus is getting worse or it's progressing. And if it is progressing, then that's a pretty good indication that if we perform this corneal collagen cross-linking, then it has the potential to slow down this progression. To go into corneal collagen cross-linking a little bit, basically what it involves is there's a sort of vitamin drop. It's vitamin B2 to be specific. The patient will have these vitamin B2 drops placed onto their eye. And then what the ophthalmologist will do is they'll apply some controlled UV light. And the purpose of both of these acting together is basically it strengthens the bonds between that corneal tissue. So the stronger the bonds between the front of the eye are, the harder it is for progression to occur because they're connected to one another more strongly. So that's really, really good for slowing down the progression. The big thing is it's not intended to reverse keratoconus. It doesn't tend to reverse the need for vision correction, but the goal of the cross-linking is to slow down the progression. But outcomes are generally quite good. It does a good job. But again, you need that baseline and you need that evidence of progression to ensure it's going to be worthwhile to send the patient off for that.
Okay, so you mentioned don't rub your eyes. That's a key message there. I guess at this time of year in particular, it's winter, so in Perth you've got those dry winds and it can be a challenge for a lot of people, particularly people who have dry eye disease. So dry eye disease is also something that we seem to be hearing more and more about that. Is dry eyes simply a matter of not producing enough tears, or is there more to it than that?
It's a great question. Yeah, dry eye is rampant at the moment, especially in Perth, Western Australia's
Mm.
environment is not the friendliness or dryness. It's a good question. So look, to answer it simply, in some cases it is a matter of producing too few tears. That's the reality for some patients, but it is a lot more complex than that. So most cases of dry eye aren't caused by too few tears, but they're actually caused by the tears evaporating too quickly. So basically, we have our tear film, and one of the major components of our tear film is actually oil. And this oil is sort of secreted by these glands called meibomian glands, which run vertically on our upper and lower lids. And they produce this oil. And again, it slows down the evaporation. But what happens in most cases of dry eye is these oil glands are actually blocked. And because these oil glands are blocked, the patient's not getting this oil into their tear film. So they might be producing enough tears, but the bottom line is the tears are just evaporating too quickly. So I guess the sort of take home point is that often rather than being about tear quantity, a lot of the case dry eye is about tear quality. Most cases I see in clinic are caused by issues with the oil glands rather than the quantity of tears produced. But it's quite a nuanced field, to be honest. I think the best thing to do if you have dryness is go and see an optometrist, and then they can figure out what's actually causing the dryness because there's so many different potential causes. There's a lot of subtleties to it. I think it's better to get it checked behind the microscope.
I always think in terms of analogies because it helps me understand things. And the way I think of the oils that you mentioned, it's like the surface cover on a swimming pool. You know, if you've got the surface cover on, stops the water from evaporating. That oil, that layer, it kind of helps prevent the moisture from evaporating from the surface of your eye, doesn't it? And if your oils or if there's something dysfunctional about the way that your eyelids are producing oils, then you don't have that protective cover happening. Is that kind of right close to the
Yeah,
mark, you think?
spot on. I'll have to steal that one from you, Paul. That's really good.
It's trademarked.
Yeah, you could. I'll give you that one.
So, what kind of therapies do you have in the practice there that might help somebody with dry eye dysfunction?
Yeah, of course. So we see quite a lot of dry eye. We have a sort of dry eye clinic out of my room at Ezekiel Eyes, which we're quite fortunate to have. As far as the treatments that we offer, truth be told, there's so many different things we can do. So the first thing we can do treatment wise is just a conversation with the patient. So we have a chat to them about the timing of symptoms, whether the symptoms get worse when they're using the screens, what type of environments are they in, are they wearing contact lenses, are they taking any medications.
Mm.
Basically, we use all that information to identify whether there's any environmental triggers. And then if there is any environmental triggers, obviously within reason, we try and improve things there just with lifestyle adaptation. So the first treatment we offer, as simple as it sounds, is just a conversation. Now, if we try that and it's still just not working, there's so many different things we can escalate to. So we offer things such as eye drops. Eye drops come in so many different types. It can be overwhelming for patients. So the first thing we do is try and identify what type of dryness it is. So whether it's tear quantity or if it's tear quality, and then we basically recommend an eye drop depending on how the front of the eye is looking. There's other special eye drops such as steroid eye drops to try and reduce some of the inflammation that dryness can sometimes cause. There's warm compresses. So we have a mask called a blephasteam, which basically gently heats up the front of the eye to try and melt some of that oil. And then behind the microscope, we manually use small little forceps to try and force some of that oil out gently in the patient's glands and get them working again. We sometimes give patients homework and we get them to buy heating masks and then
Mm.
do that expression with a gentle massage themselves at home. The other thing we have, which we're really, really lucky to have at Ezekiel Eyes in particular, is we have something called an IPL machine, or more technically, the one we have is an intense regulated pulsed light therapy machine, which is quite a mouthful. But that tends to be a very, very effective treatment for patients that have these dysfunction in oil glands. And basically, what that involves is applying concentrated light to the eyelids. And then that tends to really, really help get these oil glands working and producing again. And then we often follow it up, like I was saying, with this blephastein mask, and then we do this gentle expression as well. So just about anything you can think of, we probably have it there in terms of dryness. There's so many different options. It's similar to the contact lens conversation in that every patient is so individual. Their triggers are so individual. We have something for everyone, I think is the key message there.
So it sounds like there's a combination of answers here. So there's in clinic therapies that you offer. There are products that people can take home and use, and perhaps there's also education about lifestyle adjustments that are going to help as well.
Exactly. It's a really multifactorial condition. So I think you have to approach it with that in mind. But I mean, the important thing is no matter what treatment we give, again, it's important to come in and get an assessment so that you can match the treatment to the cause rather than just throwing everything at it. I think you need to be a little bit more precise. And that's sort of the approach that I try to take is get an understanding of what's actually causing the dryness before we try and blindly treat it.
Okay, so Jayden, I want to double back to something that you said earlier in this interview, which was you said that at Ezekiel Eyes you like to spend a bit longer with patients, and I believe that a big part of what you do is comprehensive eye examinations. So, what are you actually checking during that time, and why is it more than just updating a prescription?
Sure. So one, again, to go back to why I joined Ezekiel Eyes, one of the things that attracted me so much to the practice was that every patient is treated as an individual and you get the time to get to know them. You can ask about their day, what they're doing. And I think part of the reason we're fortunate enough to do that is because we do have a little bit longer that we can spend with the patients. So as far as what we do during a comprehensive eye exam and what it involves, I start by just asking the patient about their day, to be honest with you, before we go into the clinical side of things. But obviously, the first step is to just have a chat with the patient about their concerns. Not only their concerns, but also their visual needs. So, what are they actually wanting to get out of the exam? What solution can I offer them? What's their problem? We then take a good history. So, any medications, anything like that, systemic history, family history, as that'll also give me a pretty good idea of what's important and how to structure the exam. So, the first thing is it just starts with the history. Then, what we do is, of course, we do the vision chart, which everyone is familiar with. We have a look at whether or not there's any prescription there. We then have a look at how the eyes are focusing, how's the coordination of the eye muscles, anything like that. Then obviously we do the health. So the health check's the most important part of the eye exam, I would say. So we really, really thoroughly examine the front and back of the eye. So we look at all of the structures that make up the front of the eye. We look at all the structures that make up the back of the eye. And then if there's any concerns or anything untoward coming from that testing, then we might do some extra tests. So we're really, really lucky. We have amazing technology at Ezekiel Eyes, which I'm not sure if you've heard of or not, Paul, but we have this, what's called an OCT machine. We have these retinal photos, which take a photo of the back of the eye. We have these visual field testing equipment. So we have all of this testing equipment, whereas if something's looking not quite right, or we just want to make sure that everything's okay, then we have this equipment available, which is amazing that we can then go on and perform with the patient. It just gives us so much rich information. Again, I think the take-home message is an eye test is so much more than a vision chart. It's almost an art, Paul. I'll keep coming back to that.
And I know it's probably a bit of a cliche, but the window, also the eyes really can be a window into somebody's general health, can't they? I mean, your optometrist can maybe see the first signs of things like hypertension simply by examining the back of the eye, can't they?
Oh, it's incredible. The eye is one of the only places where you can view naked blood vessels. And because blood vessels obviously run throughout our whole body, if there's issues with these blood vessels going on in the back of our eye, then there's a pretty good chance, and we can infer from that these issues are also going on everywhere else in the body, which is why general practitioners love optometrists so much, is because we can view these blood vessels at the back of the eye and just infer so much information about the patient's general health. So not only high blood pressure, but the other one that we see a lot is diabetes.
Yeah.
So sometimes in diabetes, when we image the back of the eye or we have a look with these lenses, we can see sometimes if it's uncontrolled, these small little bleeds. And what we can infer is that if there's these small little bleeds at the back of the eye going on, then there's a pretty good chance it might be occurring elsewhere in the body. And there's a pretty good motivator to try and get our blood sugar under tighter control. So you can tell so much information just by looking at the back of the eye. Cholesterol issues as well, that also presents with changes at the back of the eye. There's so many different conditions and there's so much we can infer just from looking at the back of someone's eye. It's a lot more than people would think. It's really amazing. It's really amazing.
And because the human brain is so adaptable, sometimes there are changes happening in your vision which the brain kind of compensates for. And I'm thinking about, things like maybe glaucoma, macular degeneration, even cataracts. So are the kind of tests that you do one way of getting like an objective reading on those conditions before they get, to a very serious extent?
Yeah, absolutely. So, like you said, they're all very objective measurements, which is really good, and they all have a timestamp to them. So, we can then compare future scans to previous scans, and we can see how things are changing over time. You're exactly right, especially with glaucoma, for example. A lot of the time, glaucoma is asymptomatic, and you don't get any symptoms early on. And a lot of the reason for that is because generally the pattern of glaucoma is you start to lose your peripheral vision, but you preserve your central vision. So, what happens in a lot of patients is they might be getting this peripheral vision loss, but you don't walk around covering one eye. So, you never realize. And the other thing is, you're spot on, the other eye compensates for it. So, the way we overcome this compensation, of course, we test one eye at a time. But to go back to the equipment, is we have something called a visual field machine, for example, which is particularly helpful in glaucoma. Anyone that's done the test will remember it. But basically, you cover one eye at a time, and the patient puts their head in it almost looks like a fishbowl, and they click a button every time they see a light. And because you're isolating each eye, it gives a really, really good idea of what the patient is actually seeing day to day without any compensation from the other eye. So tests such as that are just so handy to get a good idea of what's actually going on. The other thing is, like I touched on briefly, these OCT scans, which basically uses light to produce a cross section of your retina, which is the back of the eye. And we can scan through with such precision and just see all of the different layers that make up the eye that if there is any conditions or disease or anything out of the ordinary, it's just so easy to pick up on these scans. They really have revolutionized eye care. The patient outcomes are just so much better these days because of the precision of this equipment. It's so much easier to diagnose. So we're so lucky, especially again at Ezekiel Eyes. We have amazing equipment. I feel so fortunate to have access to everything that we have access to there.
Well, Jayden, we've covered a lot today, but I hope anyone watching this now has a good sense of what Ezekiel Eyes does and why they should visit you guys for a consultation. Is there one message that you'd like people to remember about looking after their eyesight, and what would it be?
The hard question, Paul. There's so many different messages I could give you. I think the big take home message, particularly to do with eye health, is that I think, as cliche as it sounds, I think good vision is worth protecting. And I think if we've learnt anything from the conversation, I think even when nothing feels wrong and you're not experiencing symptoms, it's still worth having that eye check just for your own peace of mind and making sure that everything actually is okay. Because as you're saying, a lot of eye conditions develop quietly. So people might go on for a long time before they realize anything actually has changed. And then to sort of go on from that point, I think early detection, it just gives us so many more treatment options. The outcomes are just so much better. So regular eye exams really is the way we identify these early changes and protect sight. So get your eyes tested, I think is the take home message there. It's very, very important. It really can't be overstated.
Okay, well, so for anyone who would like to get in touch with Ezekiel Eyes, how can they do that?
Yep. So I guess the first way is through our website. So www.ezekieleyes.com is the web address for that. Also just by phone. So our phone number, I'm sure you'll flash it on the screen, Paul, is 0893863620. As far as where Ezekiel Eyes is, I know I mentioned briefly, obviously we're in Perth, Western Australia, but we're located at 69 Hampton Road in Nedlands. So also pop in as well is another way to have a chat to us. We're more than happy to help support or answer any questions that people may have.
Very good. And if you've found this discussion helpful, once again, do us a big favor and like the video and subscribe to the channel so you are notified when Ezekiel Eyes releases more helpful educational eye health content like this one. Well, so I think let's wrap up there. So, Jayden, great talking with you today, and thanks for watching, everyone.
Thank you so much. Thank you, Paul.
Okay, bye for now. Bye bye.